I've mapped India right now. We have too many people from different districts. All districts of Gujarat are covered today.
Oh, wow, that is so great to know. And I'm very lucky that I am able to converse with so many people. So,
Yeah.
in the meanwhile, I share my presentation. I just want the mothers to, kind of help me out how their journey has been. Is it been good, bad, or average? So, definitely you can rate yourself on the scale of good, bad, or average. And as Mayank told, that I will be able to take it up from there, understanding that where you require support and how do I help you. So
So it's a self-assessment, mothers. I mean, your breastfeeding experience, good meaning you are 90% getting it right.
90%, 10% of your touch and go, and then it could be a success. Average means you've been doing good, but it requires support. Bad means you're too much, need a consultation, and definitely you can seek support for baby nama. So this is how it is: good, bad, or average.
I think Ekta
And
ma'am is annotating on the shared content. I think you will have to stop. In the security
yeah,
part, you can see the option to disallow
no, I'm
participants.
not having it over here, my own.
Okay. Maybe you can stop screen sharing and then share again once.
Right,
So
I'll do that.
the annotations go away. So a lot of mothers have today are having a very bad experience.
Okay, so that is a good note for us to begin, because that's where we are there to support you, help you, and share our experiences of how the mothers are doing, right? So, welcome, team. I am Pooja Marathe. I am a lactation expert, a child nutritionist, a mother.
Seems to be some issue with Pooja ma'am's internet connection.
Am I audible?
Yeah, now you're audible. You had frozen a bit. Okay.
Yeah. Yeah. So I am an expert lactation professional. I am a child nutritionist. This is my team. We almost have more than an average of 8 years of experience. And also, we come across various cities. So these consultations are right from the point of your home, with a lot of dedicated team and support from Baby Nama. And you can have a round of questions in the sessions when you do one-on-one consults. So this is a little bit about me. More than a decade's experience, help more than 1,000 mothers at Baby Nama, and the understanding that breastfeeding is on everybody's mind. It's there. So I think one of our mothers, who is a prenatal one, you today what you will learn is you will know about breastfeeding, but how the challenges unfold after birth can be quite different. So based on what our mothers have been telling us at Divinama, that 90% of them faced a problem because probably they were not educated about it, or they knew it and they could not align themselves to the thought that yeah, these could be the challenges coming in. And 60% of them fail to understand the latch or positioning problem. Most of them were not aware about this is to be done, that is not to be done, or there were some myths around breastfeeding which were kind of exchanged with them due to from a few friends or your previous pregnancies or previous birthing experiences. And majorly what we really come consolidated to the part that 90% of the problems come with improper latching and positioning. So the challenge over here is to make us feel that, am I doing good? Is there something wrong with me? And that carries the guilt and puts the mother into pressure. So what you see is the tip of the iceberg. It is fussy baby, it is long feeding hours, which results in low output. But what is deep inside, when a consultant intervenes, she understands. Probably it could be you are having a good supply, but the ducts are blocked. Probably your diet needs to be better. Probably your sleep patterns or the feeding patterns can be changed. Okay, so the latch can be improvised. Your mindset in understanding breastfeeding needs to be changed overall. So when we understand that breastfeeding journey is very, very beautiful, now Anamika or a mother joining from Kerala, you can see this as a beautiful picture every day in and out, holding your two twins, breastfeeding your child, making your journey more successful, more beautiful, and continuing your breastfeeding journey for your twins beyond 6 months as well. So, breastfeeding your child is a choice, and it should be made as a mandatory choice, but in most of the parts of the world, many people choose to breastfeed over formula feed because they know that it has numerous benefits. Okay, and looking it from the baby's point of view, first is bonding. So every time when a child comes to you, it is not for milk. It could be security. It could be, safety. The child is comforting you. The cry of the child is going to be so melodious that you are going to know. But in the background, if you have family members, you're saying, "Arey, bacha ro raha hai, kids up, the child is crying, take him." You panic, and your panic mode button gets on, and then you feel like whether you're doing correct, whether you're in the right place, whether you are kind of making the right choice. And that is where you kind of your mindset kind of changes. But the benefits of breastfeeding to the baby is that the baby is having good immunity. Now, this is a breast model that I'm going to use for demonstration, and this is my doll I'm going to use for demonstration. So, as I tell you that the baby latches on the mother's breast, the baby sucks and takes the colostrum, which increases the immunity of the child. The child's risk for diseases go down. Every time you are breastfeeding, the breastfeeding composition is changing. Every time you are breastfeeding, the quantity and the volume is changing. Every time you are trying to breastfeed your child, the baby's health is going to improve. So, efficiently, if you breastfeed, the weight gain is going to be proper, the eyesight is going to be proper, the intellectual development is going to be proper, the gut health, the stomach health is going to be proper. Baby is not going to be colic, baby is not going to be gassy, baby is not going to pass loose stools, baby is not going to fall sick many a times. So these are the numerous benefits that a baby
Great.
receives. But what about mother? From end, she, when the baby suckles on the breast, her uterus starts contracting immediately since day one. The output of the blood discharge that also reduces. Third, me, the cancer chances of ovarian cancer, breast cancer, that also reduces. So in one action, there are 10 benefits. How beautiful it is. Okay, you are diabetic, or you are hypertensive, or you have thyroid in your pregnancy, you breastfeed your child, all your this thing milk, all your readings of your thyroid, your calcium, your diabetes, your BP, all get regularized and normalized. Your child is also not at a risk of all these metabolic diseases. So this is a good aspect. And you know what benefits out of this most is that you are losing calories. Now, we say that breastfeeding is a extended trimester. It's a fourth trimester. When you say it as a fourth trimester, a mother has to eat more than around 500 calories a day in order to supplement good amount of milk output. And every mother has a different output, so the output of mother A is not same as to mother B. And even if you are a mother of twin, your output is going to be better if you are putting both the babies to breast or making the babies suckle on the breast. So on an average, a mother can have a good output and she can stay healthy, and if she stays calm, so your postpartum health also very much depends on the benefits that you are receiving. Otherwise, when you're talking about your emotional health and emotional status, many a times family mothers do not get support. Now I would like to know over here, Whether you stay in a nuclear family, joint family, or even if you're staying in a nuclear family, do you have support? So if you have support, you can type it in the chat box, yes. If you do not have support, you can type it out as no. Please, that would be very helpful for us to understand, because mothers uh, are dependent on their mothers. So if you can also have a conversation with your mom that, how long was your breastfeeding journey, or with your mother-in-law, if you're open up, how long was your breastfeeding journey, how was it, what did the child do? So the reason being, it allows you to get a sense of social security. Now, over here, we have a mixed crowd. When mothers who do not get, support, they feel lack of empathy. And when there is lack of empathy and support, they feel lonely, and that triggers the milk production to be going down. See, whatever you do, it's all related to the hormones. And when we talk about hormones, mother's image and mother's confidence plays a very important role. Always remember that to have a healthy life, you can definitely attempt to do the best for your child. Okay, but there are social influences, there are family influences which may not allow this. This is the anatomy of the structure of the breast that I'm going to discuss about, and over here I'm going to make you understand the nipple, the area, and the other parts of the uh, breast which play an important role. Now the milk comes out from the nipples, we all know that the nipple, no, or very large. It all depends on your growth in the pregnancy. The pregnancy, there are changes which are. Secondly, if these nipples are cracked, then it is full for breastfeeding. Also, how big the breast size has grown in the pregnancy. So as you towards the pregnancy, your breast sizes, and that makes the storage capacity, natural storage capacity for the milk to be made. But why is it so important? It is important because every time you think whether your pumping is better than natural feeding, or hand expression is better for natural feeding, that allows you to understand your storage capacity. Now over here, if you see the blue grape like dots out over here, this is the cell area where the milk is stored. And you will always see that if your breast is hard, these cells swell up. Milk is there, they swell up, but milk is, if it is not taken out by the baby properly, then definitely it is going to be painful, it is going to be very very burning, itching kind of a pain. But if the milk is removed by the baby, then definitely the breast is going to be soft. So if anatomy of the breast plays an important role for you to understand in this webinar, that mothers have the ability to make milk. It's no mother is not, you know, like that in any world, any part of the world, that she cannot make milk. She has the ability to make milk, but it's the baby's effectiveness, how much the milk is taken by the baby. As per the baby's capacity, we cannot force the child, but we cannot do injustice also. You know, 45 minutes, 1 hour, 2 hours, baby is just feeding. No, that's incorrect. Baby can take two-thirds of the quantity of the milk which is present in the breast. Because of which, once the baby comes to the breast, baby is sucking. Baby is sucking, and there is a oxytocin hormone which is allowing the baby to hold the breast and do this action. And then the hormone in the brain allows for the quantity of milk to get down. So there is something known as prolactin, which is a milk making hormone, and oxytocin, which is a release hormone. If you don't get this action done by the baby, the milk making hormone will understands that there is no need, and then automatically reduces the volume of milk, because of which you think milk is not there, let us give us formula. So, because of this perceived notion, you think that you're missing on something. So, the actual process starts within the first hour of breast life, as soon as you give birth. Whether it's a preterm delivery, whether it's a normal delivery, whether it's a C-section, immaterial of how you have delivered, milk starts coming in. The first 3 days, it is watery, colorless, or yellowish, sticky droplets. Collect it in a spoon and feed it to the child. Make an attempt and feed it to the child. Ranjita, I believe it's your name, who is an antenatal mother. I would love you to try this method. If the baby doesn't suck on the breast, hand express and give it through a spoon. The more you start hand expressing, because of there could be some difficulty, you have pain in the stomach, in the back or in the stitches, you are not that energetic, take some help and hand express it in this manner. Today I did the same thing. I was helping a mother. She was not able to move, first time mom, and she had trouble expressing, feeding her child. Simply, we hand expressed, we gave colostrum, advised the family. She had a great family support. The family also supported for hand expression. So it's absolutely okay to ask for help, even if in the middle of the stage where your baby is 15 days old, 20 days old, 1 month old, 1.5 month old, hand express or pump. But what happens is when you do such things, the composition of the breast milk is going to change every time. What is the composition? It is nourishment. So when you see this ladder of such beautiful colors, growth factors, antibodies, white cells, immunoglobulins, carbohydrates, proteins, fats, the easily digested. So when the milk is made in the initial 20 days, it is whey is to casein, that is the protein content. It is higher. And as the baby starts maturing, the age increases, the ratio of casein to whey also changes. So 80% of whey means easily digestible. But as the baby's age increases, this ratio shifts from 80 to 20 is to 50 to 50. And because of which the baby is very, very satisfied. But mothers would complain that they are not having good amount of milk. That's why I just gave one feed of formula. I do understand at a given point of time, stress, baby is not opening the mouth, you are trying your level best, but it is also from the baby's side. But do we give up on ourselves? Do we give up on the choices we make? No, we try and attempt. If not direct breastfeeding, we have express breastfeeding. But always let this stay away from formulas, because it is making the child very full. Now, in the chat box, you can just type it out and say that your baby sleeps for a longer hour or no. Yes or no. When you feed formula, does your child sleep for longer hours than expected? You can just type yes. See, now can you read this? Every 100 gram of formula contains 40 grams of sugar. Very simple. You had a lovely dinner or a lovely lunch. Remember your pregnancy days, and you had a lovely ice cream or a rasmalai or a sweet dish, and you felt full, and you wanted a good sleep. The same thing happens to a baby. So when the baby sleeps, as the baby wakes up, the baby is extremely hungry, but understand that at that point of time, the baby is going to be cranky. So his feed is not going to be sufficed if the uh, formula is given. He wants more and more. That's why you try to breastfeed and then you give top up formula. Have you done this? Just type in a yes. You've given a baby breastfeed and then you have given a top up formula. Because formula is something which is very, very satisfactory thing for the baby, but is very, very harmful. You know, when is a formula made, you know the expiry date of that formula. You know you have to use it in that period only. The composition is not going to change. The composition is going to be same, and the same composition is going to make your child very dependent. So in simple terms, you're making your child build up on junk food. For us, formula is junk food, right? And we say that the child should be away from junk food, but we are introducing the child from junk food because you see the content is rapeseed oil, sunflower oil, coconut oil. All this is junk that disturbs the immunity of the child, that disturbs the absorption capacity of the child, that disturbs the stomach of the child. Formula milk gets spoiled after 1 hour. You're going to throw the formula if the baby is not used it, right? So when you have a choice to breastfeed, I would always suggest you please look at the first one rather than the next one. So here is a story about a mother who felt that she was not having enough milk, and then she started up topping up with the formula, wherein her baby got full, as I asked you. Baby overslept, but when the baby came to the breast, she had less breast milk production. So when you fall in this cycle, you also fall in a trap. And that is where you feel that your breast milk supply is going completely down and your formula expenses are completely going up. On an average, in the Indian market, a formula is which was costing around 500, 600 10 years back. Now it is 1,000 to 1,200. Do you agree with me? And your monthly expenses would go around 4,000 to 5,000. Do you agree? Is it a yes or a no? So your monthly expenses go very, very high. You're round the clock using a formula, and it becomes so very difficult for any mother to understand, that formula is not doable. But when you seek a help of a guided expert who is guiding you in through the ways to reduce formula, what you see, the demand of formula is going down, the supply has increased, your problems like cracked nipples, mastitis, blebs, plugged ducts, engorgement, all have started coming up. Now I have been having doing consultations for mom who have a good supply, but because the baby is not effectively latching, they are getting problems, they're getting pain. There are mothers who have identified the hunger cues and fed the baby on time also, but because of the ineffective latch, the baby is not able to identify. So for new mothers, for the first time moms, this is a sign of communication by the given by the baby. Now when the baby says I am hungry, he's going to put his hand in the mouth, he's going to turn his head, he's going to toss, he's going to put his tongue out. This is how it is going to happen. When this escalates to I am really hungry, baby starts stretching, baby starts moving, rigorously moving, and they don't have patience. So definitely they're going to put up a cry, which is going to make it difficult for the baby to latch. Identify the hunger cues, which makes it easy for the baby to kind of help you to latch. So when you are adopting a good position for latching, we discuss these positions, which is known as a cradle hold, a cross cradle hold, football hold, and sideline hold. Now, because I'm going to demonstrate this, I am going to show you how to hold your baby. You can also follow this with me, with your baby. No need to switch on your cameras, but this will guide you on whether, make you understand whether you're doing it correct or not. So this is my demo doll. This is my right hand, and I'm doing the cradle hold. So I'm holding the baby on the neck, and I'm putting the baby on my hand. There is a pillow on my leg, and I am holding the baby in a C. I'm holding the breast in a C shape, and then offering the breast. I have tilted the baby purposefully. You can put the baby in a horizontal position also, but I find a comfort to help mothers to put the baby this manner because the head, legs, and the head, body, and the trunk get aligned in one manner. And when I'm helping to offer the breast, the baby latches very properly. Now, even if the baby mother has flat nipples, what she can do is she can press the thumb using top part using the thumb and then insert it in the baby's mouth, and this allows for a deep latch. Deep latch means both the lips are flanged outside, they are curled outside, and the baby sucks with a better pressure. And the suck will be so rhythmic that the baby is calm, composed, and mother is conveniently talking to any person who is in front of her. If the baby is not losing contact with the breast, baby is not sleeping on the breast, and baby is very calm. Cross cradle is where I am using a right hand and putting the baby on the left side. So you're using the opposite hand and you're holding the breast with the opposite hand. This allows you to have a comfort, look at the baby, pause where if the baby is, stop, delatch, as in remove the baby from the breast, and then latch the baby again. This allows the baby not to move. So you're locking the baby. So this is going to be a comfortable position. Now, I am helping you with a football hole. In a football hole, you're resting on the bed and you have a lot of pillow support over here. And the baby is having an eye contact with you. This is especially happening with small aged babies, in size babies who are smaller, who are tiny, 2, 2 kgs, 2.3 kgs, 2.5 kgs, or 2.8 kgs. These babies can have a football hole. You can try, you can definitely give it a try. And this allows the baby to be comfortable. The mother also is comfortable because her abdominal stitches are not hurting. There is not much pressure on her back and her stomach. She's having a good eye contact with the baby, and this allows the baby to be having a breastfeeding properly. So, aram se you're sitting on a sofa, you have an armchair, you're sitting on a bed, and you can comfortably feed the child. And last position is sideline. So, sideline, I'm just helping you to understand that the baby is kept in a sideline position. Mother is also sleeping. Mother's hand is like this when she is sleeping. The mothers usually keep the hand on the pillow like this in this manner, but no, that is not correct. Mother should hold the baby towards her and lift the breast from below so that she can feed. Many doctors, around 90%, differ from doing this position because they feel if the baby is sleepy, the baby gets choked. If the mother is sleepy, the mother is not paying attention, the baby would have breathing difficulty. If the baby is not alert and mother is not alert, the milk can get into the ears and it can cause infections. So when you're doing the sideline position, ensure that you are in a little state of alertness when you're trying it. As you get confident doing it, things become better, right? Now, how does the baby open the latch? 1 second, please. Mayank, can you unpin me, please? Is it possible for you?
What do you mean by unpinning?
I've pinned myself up for the screen share. Okay, I got it.
I don't know how to unpin you.
Yeah, I got that. Thank you. Um, how do you get a good latch? So getting a good latch is going to be possible if you are having a baby opening the mouth. Let the baby, let the nipple come near the nose, nuzzle the baby on the upper lip, and let the baby open the mouth. Once the baby opens the mouth, you can press your top and let the baby open the mouth a little wider. Once the mouth is getting opened little wider, the baby is able to take the bigger part of the breast, and then you see in the fourth step over here, the mother's thumb is kept like way, because of which this is happening. The baby is able to take a better and a bigger part of the breast, but mothers complain that the mouth opening is not wide. There is a short opening. So compress the breast from the top, hold it slowly, and put it inside the baby's mouth. If the baby is only taking, if you feel that the nipple is only on the lip, you are going to have cracked nipples, you are going to have soreness, there is going to be pain. If the you're going to have, if the nipple is going to go deep inside and the latch is going to be proper, then the nipple is properly shaped. But sometimes there is too much pressure from the baby side. There could be a lip tie. It could be age related. So it's not only from the mother's side, it is also from the baby's side that the problem could occur. So understanding the breastfeeding success, we need to know whether your baby is getting enough sleep, enough urine output is there, there is a deep latch, as I told you, which is happening, your baby is passing enough motions, and also your baby is giving hunger signs in the initial days, which allows for good identification for the mother. So on an average, your baby is gaining around 300 to 500 grams per month. And if your milk supply is good, consistent, definitely you will be seeing a good weight gain. And by the age of 6 months, your baby has almost doubled up the birth weight. But if in the initial times, if the birth weight is not, if the weight is not achieved as per the growth and development, there are chances that the doctors would recommend a formula. So to avoid on all these things, we need to understand that how much quantity does a child actually require. Okay. And many mothers who are trying a pumping technique, who are trying a hand expression technique, who are trying both the techniques, are always in a state of mind whether I'm doing it correct. So I would like to ask the audience whether you are using a pump or you're using a manual or an electric pump, for me to further understand how you are going ahead with the feeding techniques. So you all can type out in the chat box whether it's a manual pump or an electric pump, and I can understand whether you're doing it good or not. See, because using a manual pump makes it very difficult for a mother. Okay, she has to hand express. I had two mothers who used a manual pump and their hand got painful, because of which they are like, ma'am, kitna pump karungi, because of which their family chose to bottle feed their child. Hand expression is where you put your fingers in these two manners and you give a press on the breast very gently, very gently. You have to see the spray of, the milk coming out, and that is how you will understand whether your flow is good or not. The diet is very, very important. So when you're choosing to use a pump, when you're choosing to use an alternative method, that is when probably you're not well, baby is vaccinated, you have to go out, or you feel that you have to return back to work and you have to start creating your milk stash. These are the situations where you actually think, it's not because my sister-in-law did it or my sister did it or my brother, my brother's wife did it. Absolutely no. Initial 2 months, according to the international rules and the recent studies, mothers need to directly make an effort to breastfeed their child. Post 2 months, they can start pumping up in order to create milk stash. That is good storage supply. So that is how your milk levels are going to be maintained. But along with that, you need to have a good diet and with the use of galactagogues. Now, galactagogues is a term where we use for herbal supplements. Now, you're using a shatavari, you are You are given fenugreek or ajwain or sont or methi, water, curd, or oats or dalia. These are good foods which help to boost the milk supply. Now, in this slide, if you see, papaya is there, brown rice is there, nuts is there, butter is there, yogurt is there, water is there. All these are important, which allow for the boosting of milk supply. Now, many of the gynecologists prescribe medications which may work, which may not work, but they are breastfeeding safe. So for every mother, it may not be a recommended thing, or she might ask lactation experts that can I continue. So for medications, you need to always understand a gynecologist is going to help you to understand the dose and course, but a lactation expert is going to guide you, telling that nutritious homemade meals, good amount of time spent with your baby during breastfeeding, latch correction, positioning is going to be more effective and consistent with your breast milk and breastfeeding journey. So there are chances of you to understand that a consultation with a lactation expert. Now you look at this mom, she's having a consultation and you see the smile on her face. Why? Because she's consulting an expert. And when she consults an expert, she is going to be happy. She's going to be happy, her issues of painful latch, poor latch, low milk supply, engorgement all get reduced. This is the time you seek support from your home, and Baby Nama is the right kind of platform where you can definitely deal with these situations, and you can regard that experts are there to guide you. Even if it's a bacterial infection, you're not understanding, there is an oral thrush, you're not understanding, an expert can guide you. But do consider breastfeeding as a red flag emergencies, which means your baby is not gaining enough weight, your baby is colic, your baby is crying very intensely, your baby is not having good weight gain, rejection of breastfeeds. At night, your baby is having a different cry than usual, always hungry for feeding. These are such emergency situations where you need to understand that you need to seek a guidance help. And a lactation expert is the one who provides you such platform, and Baby Nama is the right support where we train you, guide you, and help you explore that these things can be overcome and you can be definitely happy. So, a takeaway message from this is that your good, average, and bad journey, especially the average and bad journey, can be made a good and an excellent journey with the help of a lactation expert. Over to you, Mayank, for the next part of the presentation.
Thank you, Pooja ma'am, for the wonderful presentation. And we'll be moving on to the Q&A section. But before that, I will take 5 minutes of your time to explain how Baby Nama is helping thousands of mothers breastfeed their children naturally without any supplements. So, in the meantime, I request all of you to please in the chat box mention if you're taking any supplements or not, like supplement Katabri or any other supplements. So, so while I explain how our training program works, please let us know. Okay. So I see a few of the mothers are taking supplements. Majority of you are not. That's a good thing. Uh, but as Pooja ma'am said, in most cases, it is not the nutrition which is the problem. It is the technique which is the problem. And that is what we are helping mothers breastfeeding training program, where you get unlimited support from our experts in your breastfeeding journey. Okay. So how it works is, as soon as you enroll in this program, our team will get in touch with you, understand your problems and understand your goals. So let's say you see you're facing problem in breastfeeding your baby, you're dependent on formula. and your goal is, so I'm going to start off within a couple of months, and I want to be able to uh, express enough breast milk and give it to my babies and everything, right? So based on that, we will assign you the right expert. Within 24 hours, you will have your first consultation, and the expert will guide you if any particular diet is required or not. We only prescribe home cooked diet. We don't prescribe any external granules or supplements unless needed, unless there's an absolute need. Okay. And after that, our team will connect you with the expert with the help of a personal group, so that you can have one-on-one chat with the expert, and the expert can monitor what the progress is. And post this, there are weekly assessment for the right thing. So I see Pooja ma'am is asking suggest tablets. See, tablets are not the problem, Pooja ma'am, and I want to tell it to everybody. Tablets are not going to solve it unless the technique is perfected. So that is what we need to figure out first. What is wrong in the baby's technique, right? So till now, Baby Nama has helped 10,000 plus mothers in their breastfeeding journey. We have a team of qualified experts. You will see improvements from day one, and we have a 97% success rate in establishing the breast milk supply at the end of the first month. At the end of 1 month, basically, it's a 1 month program, right? Now, one obvious thing a lot of people ask us is like, I'm from the customer support team. I talk to a lot of mothers taking feedback for consultations and other things. So they ask us, how can milk supply increase without supplements? Now, the point is, you all must have done a lot of blood tests before childbirth. Had there been any problem with your nutrition, the gynecologist would have recommended you the correct medicines and supplements there itself. Suddenly, after, so the point is preparing your body for breastfeeding before the child arrives, and your body is mostly prepared. The problem is not that there's something lacking in your body. Okay. So here I have a screenshot from Suparna ma'am. She was also facing the same thing. She was taking a lot of granules and other things, and she was still feeding formula to the baby. But after about 2 weeks, about 16 days, this was the message we got from her. She even shared a photo of her pump. So she wanted to express milk. That's her choice. But she was able to get enough breast milk. So she now has a surplus supply of milk without any granules. So this is completely natural. Okay. The other thing a lot of mothers ask is, how will online consultation work? So with the current video technology, it is absolutely efficiently possible for experts to understand the problem that baby is facing. See, the point is, the baby is also equally involved in this process. It's not just you. The babies might also be facing challenges. With the help of a personal consultation, our experts assess that what is the issue that baby is facing. Because right now, baby cannot communicate what issue the baby is facing. Right? So I have a few screenshots from mothers just after the first consultation. So this is Roja ma'am, and she said that her latching issue was resolved after the first consultation. Madhu ma'am, her baby has slept just with her milk without any formula. Anika ma'am, she is having relief now, but the process is not yet complete. These are just after the first consultations. Then Simantini ma'am, supply has increased 12 to 15 ml, which is obviously we are not claiming that after the first consultation you will see all your problems get resolved. But it's a journey, and Simantini ma'am's journey began well, and Diksha ma'am as well. For thank you so much for telling me how to pump and help my baby latch. So even pumping, even if you have a pump, you might not be using it correctly. You might need assistance to understand how to pump efficiently, and that is where expert guidance is needed. Okay. And now I'm pretty sure all of you must have already consulted with your gynecologist or pediatrician about this problem. Now, the reason why you need a lactation consultant is because a lot of time doctors who have not specifically trained for this might not have the right knowledge. So I have a video which I'll just play from one of the mothers who is a doctor herself, who joined this program, and just listen to what she has to say. So she's a doctor herself, but still she faced the problem. Sorry.
So I'm Dr. Sushmita and I'm an anesthetist. And being a doctor, also, though I knew about the theoretical part of breastfeeding, its advantages and everything, but I very little knew about the lactation part. So I had an emergency section at 36 weeks. I delivered a baby boy, and like most of them, my hospital people also didn't let me latch my baby in the first day. So I had to give formula to my baby for 3 days, and then I was trying to latch my baby. And same like many of the first time mothers have, my baby was also not latching, and I also had a flat nipple. So I tried many things. I tried syringing, I tried pumping, and I had cracked nipples. All this has happened to me. And I think on day 6, I came across Baby Nama, and I had my call with Vinodini ma'am. I still remember June 10th, I guess. So she told me what was the problem. The positioning itself was very wrong. How was I holding my baby? How was I trying to bring my baby to my breast? So then I came to know that my baby was having this flow confusion rather than the nipple confusion. So each palad I feed, I started giving 15-20 minutes like that. And slowly, I think on day 11 or day 12, my baby started to latch, and thank goodness. And slowly, everything has become normal. So now my baby's latching perfectly. Everything is good. Baby's gaining weight. Mothers, please, whoever are anxious, don't be anxious. Stress yourself as I did. Please, your baby is soon enough. Your baby will latch on you. And today is day 28, and I can see how it has changed for me. And I really thank all the and really thank Bina and mom especially.
So that was Dr. Sushmita, and as I told you, she's a doctor herself. And as you could hear from her C-section delivery and flat nipples, cracked nipples, she tried syringing, she tried pumping, nothing worked. Came for consultations. Within 10 to 12 days, her problem was solved, and now she's able to breastfeed without any of those equipments. So that is the power of right guidance. So I'm just dropping the link of the training program in the Meet in the chat group. If anybody wants to explore, you can. We also have a coupon code Feed20 applicable till tonight in case anybody wants to get a 20% discount on this. So you'll get it for under 2,000. That's less than 1 month's formula. Okay, so let's move on to question and answer quickly. Yes, I am just sharing the link in the group as well. So meanwhile, whoever has a query, can you please raise your hand? Switching on camera is mandatory for asking queries because it's important for experts to see you how you're doing things. So please switch on your camera if you're asking query. Please raise your hands and we'll go one by one. So do we have no queries today? Uh, Please raise your hand if you have any queries. So whoever has any queries, Nomi ma'am, if you want to ask the query, you can just raise your hand and unmute yourself. I think, yeah.
Hello, sir. Am I audible?
Yes, yes, you are. Yes.
Yeah,
Please
sir.
ask it, ma'am.
Yeah, sir. Sir, now I am a 6 months old mother. I want to know about the storage of breast milk and how to transport from my working place to my home.
Okay. So, Indu, that's a very beautiful thought. Congratulations. You're joining
Thank you,
back
ma'am.
and you are expressing it out. Um, how far is your working place?
It's 1 hour travel, ma'am.
1 hour travel. So definitely you can store in milk bags which are available. So there is a
Yeah.
company called there are various companies which have these milk bags making. You can order them, and if your milk production is good, you can store it in them. Label it as date and time, and
Okay.
1 hour time travel time for you to come forth
My
and go back and everything. It would be a little difficult, so what you can do, you can get a ice box.
okay.
Okay, in your place, in the workplace where you have, you please ensure there is a refrigerator.
Okay.
Okay, if you get a ice box and these ice packs, ice gel packs,
Yeah.
that will help you to store your milk. So you can take your you can schedule your pumping before you leave for work. You can do the pumping during your work time. Write a letter to your manager and HR, get permission from there, because pumping it in a different room and pumping in it in a various different room is going to make a difference. So pumping in a workplace should be clean, hygienically sound, so that the
Okay.
milk doesn't get spoiled. Okay.
Okay.
Wash your hands with soap. Pump for a duration of 20-25 minutes. Store, and you can have a 4 hour or 3 hours as per your work. Store this milk in the bottles and put it in the ice pack. While traveling home, carry this ice pack with you. That is how you can make this milk stash. And when you come back at home, first thing you're going to do is you're going to feed your baby.
Yes.
Continue night feedings, and during the day you can do this. If you're doubting about your milk supply,
Okay, ma'am.
but
Fine. If there is
stress is something which you need to stay away from, because joining back is difficult. But yes, you can come back for a consultation, understanding how to make it more effective.
okay, ma'am. And one more thing, if there is no refrigerator available in my workplace,
Then
means
it becomes difficult for the storage.
without that
Wi-
ice pack.
yeah, without the see, our milk is a perishable good.
Okay.
Keeping it outside for 4 hours, it's okay. But more than 4 hours, it needs to be under refrigeration, and
Okay.
uh, otherwise it will get spoiled. It's bacteria and various organisms will work upon it and spoil it up.
Okay. Okay, ma'am. Thank you.
Welcome.
Hello, good. Hello, am I audible?
You're audible, you're
Yes,
not
Nomi, ma'am.
visible.
Yes.
Hello.
Yes, Nomi, ma'am. So we'll
Yeah,
just
yeah.
take
So
one
I
more
wanted
query
to
after
ask,
Nomi, ma'am.
what is the best way? So I wanted to ask, like, I have expressed my milk. Now, what
Uh-huh.
is the best way to give it to the baby? Is it via bottle, or with the help of a spoon, or with the help of a paladin?
I would suggest directly with a small katori. Okay, so you have a katori of this sort, Naomi. You have a katori of this form. You put it directly to the baby's lips, and the baby starts lapping. You use a palada, you use a spoon, there is a stopgap arrangement. Okay, but in a small katori, you are you there with me? Because I see there is a network issue.
Yes, yes, I can hear you. I can hear you.
Okay, but I'm demonstrating it as well. So, Mayan,
Yeah,
can you
yeah.
stop sharing your screen? Yeah. So this is how you're taking a katori, putting it on the lips, closing the lips of the baby, and then you're tilting. Because what happens is you'll use palada, you'll use spoon, but the baby is very hunger. It's like very hungry. So the baby might cry out loudly. Bottle nipple will is going to cause a confusion with this nipple, with the breast nipple. So it is very, very important for you to use a katori, direct feeding.
Okay. Thank you so much.
Thank you.
Welcome.
Thank you, Nomi ma'am. We'll just take one more query. Unfortunately, we won't have time for more. So, Tanshu ma'am, 8 days old baby boy, can you please unmute yourself and switch on your camera? In the meantime, I've shared the training program link in the group as well if anybody wants to explore it.
Yeah. Hi, am I audible?
Yes, Tanshu, you're audible.
Okay, all right. So I have two questions. The first question is that my baby is only 8 days old and he's not latching onto the breast properly, because of which my nipples have become sore and they've also started bleeding. Now, in such case, how do I one breastfeed, and is pumping okay to do in this duration?
Okay. Tanshu, first of all, congratulations. You've just come home. I
Yeah.
would ask you to take some time out for yourself and relax and let soak in what you have had through the last 8 days. Okay. Very simple technique. Hold your thumb on the breast, press it down, it forms a banana, gets inside the mouth. If the
Okay.
nipple is protracted, but
Hmm.
if technique doesn't work, definitely you can book up a one-on-one consult, because here if you start latching the baby properly, then your milk supply is going to increase, your soreness of the nipples is going to go down, your cracked nipples are
Hmm.
going to go down. The crack of the nipples has come because your baby was only latching on the nipple, not on the
Hmm.
areola. So
Hmm.
ensuring that you hold up the breast properly, position the baby properly, and let the areola get inside, that will help for good uh, latch correction. Okay.
Okay. Okay. Is
And
there
I've
any
demon
specific,
yeah.
yeah, any specific position that you would suggest for a better latch?
For a better latch, it's at your comfort. I have explained all the four positions,
Hmm.
but with a lot of pillow support, you need to understand, make yourself comfortable first so that you can hold the baby. If you have had
Okay.
stitches, back
Hmm.
pain,
No.
it makes a little uncomfortable.
Okay. All right.
So give yourself a little rest, stay positive, and hold. But if the technique is not working, definitely get back to me. That
All
would
right.
be okay.
Okay. Just one last question I have. Also, the baby seems to be latching onto one breast properly and is not latching onto the other one.
That is
I mean, he was
absolutely
latching onto that.
normal. That is
Okay.
absolutely normal.
Okay. All
Okay.
right.
And your question of using a pump, it is too early to start pumping right now because the milk establishment has not happened. So let the baby suck effectively, let the milk flow be consistent, then we can understand on how to work on the pumping techniques. But do not
Okay.
use
All right.
any kind of a bottle right now because that would be creating a nipple confusion.
Okay. So I'm using a nifty cup at the moment.
That is
Should
very
that be okay?
wonderful. That is very wonderful.
Okay. So if the baby is not latching onto one breast, should I let him continue feed onto the one breast that he is latching on?
Yes. So on the other breast, which is making it very difficult for you to
Yeah.
latch,
Yeah.
we can try up a football hold. If that is not successful, you can definitely book up a consult. But I
Okay.
would
All right.
like you to
Sure. Thank you.
explore more options with a consultation. That will guide you better.
Sure. All right. Okay.
All right. Thank you, Tanshu ma'am. Unfortunately, that is all the time we had, and thankfully, that is all the questions we had. So thank you, Pooja ma'am. But I am here. If anybody wants to ask any queries about how the breastfeeding training program works, I've just dropped the link on the groups. I've dropped it here in the group chat as well. So please explore the site and let me know if there are any queries that I can help you with. And thank you, Pooja ma'am, for the wonderful session. I'll take it up from here.
Thank you, Maya.
Any last words that you would like to leave mothers with?
Believe in yourself. This is a beautiful, magical journey. If you require help, to get to us.
Okay. Thank you. Thank you, Pooja ma'am. So yeah, I've just dropped the link of the site, and let me also share how it will work. So this is the site, you can go here. So those who are joining from Instagram, the link is there in the bio. So you can go on the bio and you can click breastfeeding training program. And this is the 1 month plan. You can just enter your phone number. Okay, and you can, yes, Isha ma'am, please let me know what query do you have. You can apply the coupon code feed20 and that will give you a 20% discount on the plan. Yes, Isha ma'am, you can unmute yourself and switch on your, you can just unmute yourself, whatever query you have. So the coupon code is feed20. The coupon code will not be shared on the group. It is applicable only for those who are attending the session. So if you can remember it till tonight, if you need time to discuss it with your partner, you can try to remember the code. It's not very complicated. And once you apply, the charges drop down to less than 2000 rupees, 1999. You can click on buy now, and that will just redirect you to the Razorpay payment gateway where you can choose your choice of payment and make the payment. So,
हेलो
yes, Isha ma'am.
यस सर मेरा ना क्वेश्चन है मेरा ना बेबी हुआ प्री मिच्योर
Okay, ma'am.
8th मंथ की स्टार्टिंग में हुआ है अभी
Okay, ma'am.
1 मंथ हो चुका है वैसे उसको
Okay, ma'am.
और उसका वेट भी थोड़ा गेन अप हुआ है 1 kg 900 के आसपास है अभी उसका वेट
Okay.
तो मैं ये पूछना चाहती हूँ मैं उसको डायरेक्ट लैच करवा सकती हूँ डॉक्टर ने वैसे मुझे मना किया है कहते 1-2 बार ट्राई करो ज्यादा नहीं करना
Okay. सो मैम मैं तो एक्सपर्ट नहीं हूँ एंड मैं तो यही कहूँगा कि आप एक्सपर्ट्स के साथ कंसल्टेशन बुक कर सकते हैं, ट्रेनिंग प्रोग्राम आप बुक कर सकते हैं। आपके डॉक्टर को इस बारे में एक्सपर्टीज है या नहीं ये मैं नहीं कह पाऊंगा। मैं ये
ओके
कह पाऊंगा कि सारे डॉक्टर्स को लैचिंग के बारे में सिखाया नहीं जाता। ये
ठीक है
थ्योरेटिकल नॉलेज दी जाती है कि ये मदर के अंदर ये हार्मोन से दूध बनता है, ये होता है, वो होता है।
हम्म
बट जो टेक्निक है ना, वो
हाँ
लैक्टेशन
जी
एक्सपर्ट्स को ही आती है। वो एक
ओके
मेडिकल सिस्टम में ही खराबी है। आइडियली सिखाना चाहिए किसी को डॉक्टर में, बट वो नहीं सिखाया गया। एंड जैसे ही फॉर्मूला आ जाता है एंड ब्रेस्ट पंप, निपल शील्ड जैसे
हम्म
आ जाती है, तो बच्चे को
ओके
कंफ्यूजन होना शुरू हो जाता है। अब
नहीं
फॉर्मूला।
बाकी मेरी मेरी गुड़िया वो थोड़ा लैच करती है वो सक करती है बट मुझे ये नहीं पता वो सक ओनली सक ही करी है या मिल्क भी उसके माउथ में जा रहा है मतलब इस चीज की भी मुझे कंफ्यूजन है ना
मैम ये सारे कंफ्यूजन वैसे आपके वन ऑन वन में सॉल्व हो जाएंगे। आप एक बार ट्रेनिंग प्रोग्राम की साइट पे जाके आप अपना ज्वाइन कर लीजिए। एंड
ओके सर
इसमें बेसिकली आपको अनलिमिटेड सपोर्ट मिलेगा और तब तक मिलेगा जब तक आपके प्रॉब्लम सॉल्व नहीं होगी।
ओके
ठीक है,
ओके
तो 1 मंथ में देर इज अनलिमिटेड ब्रेस्ट फीडिंग सपोर्ट। सो यहाँ पे आप देख सकते हैं अनलिमिटेड लैक्टेशन सपोर्ट फ्रॉम एक्सपर्ट ऑफ योर चॉइस। तो यहाँ पे हमारे सारे एक्सपर्ट्स हैं। सो यू कैन
ओके
चूज
ओके
आपको
सर
कौन से एक्सपर्ट जिनकी अवेलेबिलिटी है वो आपको बता दी जाएगी। एंड यू कैन चूज
ठीक है
कौन सी लैंग्वेज में आपको डिस्कस करना है एंड अकॉर्डिंगली यू कैन।
इनके साथ कैसे कांटेक्ट होगा सर
मैम पहले तो आपको ये साइट पे जाना होगा। मैंने अभी ग्रुप चैट में मैं फिर से डाल देता हूँ। ये रहा,
ओके
आपको यहाँ पे साइट पे जा करके पहले तो आपको पेमेंट करनी होगी, यहाँ पर अपना फोन नंबर
ओके
डाल।
ओके
और फिर हमारी कस्टमर सपोर्ट टीम आपको रीच आउट करके आपको स्लॉट्स के बारे में बता देगी। और फिर वो
ओके
एक वीडियो कॉल होगा जूम पे, पर्सनल कॉल होगा जिसके ऊपर आपके साथ कंसल्टेशन होगा एक्सपर्ट का।
ओके सर ओके थैंक यू
Okay, welcome, ma'am. So there is no artificial supplements that we are going to recommend in these things. You can actually go on this site and you can scroll down. And I'll just like to tell that recording of the session we won't be able to share, unfortunately. Uh, so, so you can see a lot of mothers here who have given their feedback, and I guess there are a few mothers who even had twins. Uh, I don't remember कौन mothers थी जो उनके twin babies थे right now. But there are multiple mothers who had twin babies and were able to resolve their issue. Every mother who's joining this webinar has some issue. but our experts are very much able to help. Most of them, 97% success rate, that has been the success rate till now. So अगर किसी और को और कोई query है about how the program works, so you can let me know. Okay. From those on Instagram and YouTube who are joining, if you have any query, you can just click on this WhatsApp icon. So once you go on the site, there's this WhatsApp icon in the bottom right. You can click on it and you can initiate a chat with our customer support team, and they will be happy to help you with any query that you have about this program. Okay. Okay, so the coupon code is feed20. If anybody wants to use that, coupon code is feed20. So you can just enter your phone number and then you can apply coupon code feed20. So when you do that, you will be able to get the discounted amount, which is 1999 rupees. Okay, so if there are no more queries, I would end this session now. I request you all to visit the site when you can and check out the testimonials. I'm sure you will resonate with one of the mothers. We have helped countless mothers with C-section delivery, with cracked nipple and sore nipples who have tried pumping, who have tried different granules and nothing worked. But this works. Okay. So my last words before closing this webinar will be try the tips given here for a maximum of 3 days. You can wait. If you see results within 3 days, great. If not, don't wait any longer, because the longer you wait, the more time it takes our experts to resolve the issues. So if you want to start with us, we have helped mothers get on with their journey from day one. So as soon as you enroll within the first, after the first consultation itself, you will start seeing the impact. You will start seeing that 10, 12, 15 ml increase in your breast milk supply. So I would like to end with that, and thank you all for attending the webinar today.